A psychogenic blackout is a blackout usually relating to stress, where the patient blacks out but there isn't a change in heart rate, blood pressure or brain waves. I'm not sure that anybody really does quite understand why people will suffer psychogenic blackouts or what causes them. It seems to be the response of the brain to significant stress, which perhaps, for want of a better term, the brain turns itself off as a response to that stress. It's difficult to know why stress can lead to such dramatic psychogenic blackout. And I think it's important to recognise that this is not routine levels of stress, not the sort of stress that one might suffer on a day-to-day basis. These are very severe levels of stress, perhaps in some occasions relating to previous child abuse, where essentially the brain seems to turn itself off for fear of needing to cope with this level of stress. So it's a stress response to very severe levels of stress. I think the diagnosis of psychogenic blackouts is difficult. Often it comes down to witnessing an event and a psychiatrist or a neurologist or a cardiologist witnessing an event where the patient appears to lose consciousness, but heart rate, blood pressure and perhaps brain waves on an EEG remain entirely normal. The diagnosis of blackouts of any form can be difficult. For many people, I think that it's very easy. The diagnosis is very obvious. But in some patients, there can be features that are common to psychogenic blackouts, to syncope, to epilepsy. And perhaps the way that the information is presented to the doctor can be difficult. Sometimes witness accounts of a particular event may provide slightly inaccurate information. And sometimes the doctor themselves is perhaps feeling that the diagnosis is something different to the psychogenic blackout. So all three of these events can be very complicated and can pretend to be each other. So it can be very difficult.